So I'd like to tell you a story about one of my patients. Her name was Lena. I'm protecting her privacy and confidentiality, so I'm going to give her the name of Lena. But Lena came out from her country to visit her daughter, who was living in Australia with her husband. She was having her first baby. This is a grandchild for Lena, being born in Australia. And she was planning to spend 6 months with her daughter for the birth of the grandchild. Lena had some heart problems and a little bit of diabetes. And while she was in Australia, after the birth of her granddaughter, unfortunately she suffered a stroke. So she was brought to the hospital very, very quickly, and it was clear when she came to us in the intensive care unit that the damage to her brain was terrible. It was terrible. And it was very hard for Lena's family to understand. Most of the family were back in her home country. She had her daughter and her son-in-law and her husband with her here at the hospital. But it was very hard. So we had to get interpreters, and we did a lot of phone conversations with family overseas to help them understand that while Lena was in our intensive care unit on the ventilator, her brain was so damaged that unfortunately it died. So we were discussing end of life and end of life rituals with the family and what their wishes were now that Lena's brain had died and she was dead in the intensive care unit on the ventilator. And as part of end-of-life rituals, we also ask people what their end-of-life wishes are. And organ and tissue donation is an end-of-life wish. For some people, they want to be cremated, they want to be organ and tissue donors, and so on and so forth. People sometimes like to have blessings, and when we have end-of-life discussions with family in the intensive care unit, we ask about all of these things. So organ and tissue donation is brought up at that time. The family, as you can understand, for all families in this situation, were very, very upset. But when the doctor and I started talking to them about organ and tissue donation, I saw a change straight away. And Lena's daughter said to me, she was nodding, she started nodding, and she said, we've talked about this. Back in our home country, my uncle needed a kidney transplant. So we got a leader from our religion to come and talk to us when he needed a transplant to help us understand what it meant for our religion to be organ and tissue donors and to have a transplantation. So their whole family had a meeting and they decided that for their religion it was a good thing. It was important to save life and to preserve life. So luckily Lena's brother in their home country, he got a kidney transplant and he was able to come off dialysis. But the other thing it did for that family was it started that discussion where they talked to their religious leaders, they talked to each other, and they registered to be organ donors. So when many years later they were here in Australia and we were talking about it, they knew exactly what they wanted to do. And I could see from that incredible sorrow at losing Lena that they were then thinking of saving other people's lives. So again, we had with the interpreter, another teleconference with the family overseas, and all of Lena's children said, yes, this is a good thing. And her husband said, yes, this is a good thing. And that night, Lena was able to donate her lungs to one recipient, her liver to another recipient, and both of her kidneys to 2 other people. So that night, she saved 4 lives. There were 4 lives transformed. And I've spoken to Lena's family since, and they said that the donation and that experience and knowing that they were helping other people just made it so much easier for them and for the family back home overseas who weren't here and weren't able to see her, but to know that her final wishes were to help other people. And that gave them a lot of comfort at that time. So I think that was very, very beautiful for them. And it was a very positive thing for us to help them to make her wishes come true. So that was really beautiful. And that's what we do. We work with families. We try to help them to fulfill all of their end-of-life wishes, whether it be a blessing or whether it be something like organ and tissue donation. But what I do know from all of the families that we meet is that when they say yes, they always feel better about it. And I met a funeral director recently who said that a lot of families are now announcing at funerals that mum or dad or auntie or uncle were lifesavers, and that's very special for them. It's a nice legacy to have.